Imagine the core of your body as a soda can. The top of the can is your diaphragm. The cylindrical sides where you place your hand are your abdominals and your back muscles. And the bottom of the can, which holds all of the contents from falling out, is your pelvic floor. The female pelvic floor is comprised of 12 skeletal muscles organized in 3 layers. Normal support of pelvic organs, like the bladder and uterus, is dependent on the integrity of these muscles. The pelvic floor is an essential part of our core that helps to stabilize our posture, as well as assist with load transfer from our lower to our upper body. Now, just like any other muscle in our body, the pelvic floor muscles can undergo trauma and become damaged. For example, let's take a situation like carrying a baby around for 9 months and then delivering it into this world. Pregnancy and childbirth are major risk factors for developing pelvic organ prolapse, or POP, which is the descent of pelvic contents out of the vaginal opening. POP has detrimental implications on daily activities such as bowel and bladder, sexual function, and quality of life. $1 billion are spent annually on pelvic floor dysfunctions such as POP. Out of all the women who birth a child, 50% of them will experience some degree of POP. 1 in 7 of those women will undergo an invasive gynecological surgery, a surgery which ends in failure 58% of the time. Sounds encouraging, doesn't it? Well, this bundle of stats inspired me to dig for interventions that I can provide as a physical therapist. I came up with the research question: in symptomatic postpartum women, does pelvic floor physical therapy decrease the severity and symptoms of pelvic organ prolapse? The good news is, as I started to search in the most current literature, my faith began to be restored. Recent research has concluded that pelvic floor muscle training is an effective intervention to help strengthen the pelvic floor muscles and restore its very important function. In a randomized control trial, which I plan to one day replicate, 74% of women with symptomatic POP experienced a decrease or complete resolution of their symptoms by participating in a physical therapy program designed for the pelvic floor muscles. Simple exercises like bridging while contracting the pelvic floor or completing bird dogs, as the silhouette shows, are 2 examples of pelvic floor muscle training. By the year 2050, it is estimated over 5 million women will have pelvic organ prolapse. However, I believe with education and providing women with proper rehabilitation, we can change this statistic. We would never send a patient home after a knee surgery without educating them on their risks and providing them with a rehabilitation program. It's time that we hold that same standard of care for postpartum women. Thank you.